clinic page, now you probably find that, well, this is too professional topic, like we're talking about acupuncture point, right? Just join us, don't worry, just go with us, you know, being here with us, and just relax. And we're gonna mention a lot of points that you probably didn't know what they are, you know, where they are. Don't worry, just go with that and see what sort of strategy that acupuncture is actually will do and what's in our mind, you know. This is just giving you more information. Now, I want to let you know this is just we have this camera in our website, and in this video below down there, and you should read it before you really use my point. Okay, it's neat, or everyone is different. Okay, so this is one of the strategy. It doesn't mean that it can treat everyone, can cure everyone, but this is one of the strategy that we use. When it doesn't work, we have other strategies. Okay, but this strategy is much easier for you to follow. Okay, easy to follow, easy to copy and paste on your patient. All right, now we talk about Western medicines for hot flush yesterday, right? Now, a lot of disease, I remember when we talk about angina, we talk about polycystic ovaries symptoms, we talk about fibroids. All this disease, it can, when it comes to Western medicine, it gives you drugs, medication. In the end, you may be able to get a surgery for it, you know, involve a lot of surgery. But when it comes to hot flush is a symptom. It's not a disease. Menopause is a disease, but hot flush is symptoms. It can cause from many other things, right? So more obvious for sure that we know that will cause hot flush is menopause, pre-menopause, right? Then this is causing by the hormone imbalance. Then we know it. So which means when it comes to treatment in Western medicine, there is no surgery for this hot flush symptoms if it's causing by menopause, right? The only thing that they can do is hormone replacement therapy, or we mentioned about non-hormonal treatment, which is using some antidepressant. Those are not going for treat the balance the hormone, right? Now we also mentioned that hormone therapy, hormone replacement therapy it can be a risk for cancer. So not many people would like to use it unless they didn't know that, unless the symptom hot flush is severely impact in their life, and therefore they will consider the use, right? But it's different when it comes to acupuncture, because there is no side effect for it. When we say there is no side effect, when you have acupuncture, compare with hormone replacement therapy, acupuncture and Chinese herbs both have not got any side effect of leading to cancer. Does it make sense? So apart from acupuncture and Chinese medicines, there are many things that you can do if you suffer from hot flush. Now, this topic is more for acupuncturists. Then I want to share with you, I want to tell you, apart from acupuncture and Chinese medicine, for all my patients with hot flash, I tell them clearly in the very first visit that you are not going to just rely on acupuncture and Chinese herbs, because there are so many things that you can do at home. There's something I want to share with you tomorrow and the next day is acupressure point for hot flash. What else? Diet change for hot flash. And again, I never have hot flash, so I don't have the experience myself changing diet and to get benefit from hot flash. But my patients do. They have the experience. And in fact, they share with me, some of them, they share with me before they come for acupuncture, what they have done, then has been help for hot flash. Then I want to take the chance in the next couple of days to share with you as well. So remember to follow us in the next couple of days. If you're a patient, if you're a practitioner, then you have to follow us to be able to know what else can you do when you see hot flash patient, or if you suffer from hot flash. Okay, the first strategy in Chinese medicine and acupuncture I want to share with you is heat balance. Right, heat balance. Now, you might want to take a pen and write it down, because I have few camera in here that I may not pointing to all of the camera that you can see. So get ready with your pen. If you miss it, don't worry. You can type it down and ask me again, or leave a comment down there, ask me again, or watch the replay. Right? All right. The heat balance comes with 4 meridians. 4 meridian. Okay, I'm gonna put it in just one camera. So 4 meridian, that is heart meridian, and that is also small intestine meridian, liver meridian, and gallbladder meridian. As you can see, liver, gallbladder, wood, small intestine, heart, fire. All right. So what point I'm introducing you for the point strategy is using meridian conversion. It's not going for post diagnosis. It's not going for image. It's going this point. You get it for meridian conversion. So on your right side, heart 8 and 3, liver 8 and 3. Oh, sorry. The liver, yeah, liver 8 and 3, and that's simple. Or 8 and 3. Now on your left side, heart 3 and 7. Right. And gallbladder 41 and 34. 41 and 34. That's it. Right. So this strategy can use on in any hot flashes treatment, whether that is premenopause, whether there's no reason, you don't know what reason causing it, it's not hormone imbalance that causing it, then you can use this strategy. No problem at all. Okay. Now, when it comes to what do you call it? Menopause. If menopause causing it, we know pretty sure, which most of the cases in your clinic, I believe, when they come for hot flashes, is related to menopause, right? The hot flashes make them very uncomfortable and sweaty, and the comfort treatment, it's causing by imbalance of hormone. There's a lot. So we have one in here called female hormone balance. Again, 4 meridian for this. The 4 meridian is heart, gallbladder, well, as well as Szenan and spleen. Now we're using meridian conversion again to get the point. So on the heart and gallbladder, which is on your left side, there is heart 3 and heart 7, GB 34 and 41. Then on your right side, that is Szenan 1 and 4 and spleen 1 and 4. Simple, right? Now, when your patient comes for hot flashes treatment and she is in menopause, which we can combine those two strategies, which is heat balance and hormone balance combined together. And how do you do that? As you can see, on that side, heart and GB, on that side, and heat balance and hormone balance, both of them got heart meridian and GB, and both of them, the point are both heart 3 and 7, GB 34 and 41. So you don't have to put extra needles, but on the right side, you just need to put all 4 meridian with 8 points together, which is small intestine 3-8, liver 3-8, Szenan 1-4, spleen 1-4. Put it all together. So combine 2 strategies in one when it comes to menopause with hot flush. Make sense? All right. This is just one of the strategy that we use in menopause for hot flush. And this is just one of the strategy for hot flush. Any hot flush you can use heat balance. Now in here, in Chinese medicine, we talk about, well, whether this is insufficiency hot flush or excessive heat of hot flush, right? Now, what happened in here is, it doesn't matter whether excessive heat or insufficiency heat that causing the hot flush, because by using this strategy, the heat balance with meridian conversion, when it comes to meridian conversion, it doesn't matter whether it's in deficiency or in excessive, don't care, or whether it's it's in deficiency that young excess or the young excessive. It doesn't really matter. Okay, doesn't really matter. So happy day safe, repeat again. So heat balance on your right side, write it down. Heart 3, heart 7, GB 34, 41 on your left side. Sorry. So you need to write down yourself. On your left side, on your right side, that is small intestine 3-8, level 3-8, heart 3-7 on the left side, GB 34-41 on the left side, and then female hormone balance on the left side. There is heart 3-7, GB 34-41, right, on the left side, and then Sanjiao 1-4, spleen 1-4 on the right side. Okay, right. So I mentioned about this work for just about everyone, but there are some cases that it doesn't work. Of course, when some patient may respond to if there are indeficiencies of hot flush, you put this strategy, it may work. If it doesn't work, then you have to treat indeficiency by selecting different points. If the heat is excessive in certain organs, then you need to go and treat these certain organs. Let's say it's in the kidney. Unfortunately, we are not treating kidney in here, or not on the kidney meridian. So you need to go and treat the kidney meridian. Does that make sense to you? So which means there are other strategies for hot flush. This is just one. I don't want to mislead you that you think this strategy will work for everyone 100%. No, it's not, right? So what are the strategy that I normally use is I use post-diagnosis. So when I find out what post, now when it comes to post-diagnosis, I really want you to understand one thing. What is balance? I always share with my patient and I say, what is balance? This is balance, right? And this is imbalance. This is imbalance. So balance both on the same level. Well, this is imbalance. When this side of imbalance, which means in here, this is the weakest, and the other is strongest. Or when the imbalance is like this, again, strongest, weakest. What does it mean? It means when you treat your patient, you find the imbalance. Imbalance is always two things compare. A comparison of both, at least two things. If there is just one thing there, you can't find any imbalance at all because there is no comparisons. So balance, you compare one to the others. When it comes to organs theory, that we have 12 meridians, and you compare all 12 meridian and organs, Zhang and Fu organs, you compare all together, and you figure out the strongest and the weakest, and you treat one of them, one at a time. Either you treat the strongest or you treat the weakest, because hot flush is a symptoms. It can caused by kidney and bladder out of balance. Then you treat kidney and bladder. Are kidney or bladder the strongest or the weakest? If strongest, you choose the point to reduce kidneys and bladder. If the weakest, you choose the point to tonify kidney and bladder. So this is the principle. So there are many other strategies that work very well for hot flushes. I want to share with you in here. Now, when it comes to pose, I need to show you how to take it. I'm sorry that in here we're not possible to do that. So the easier way on my live video is I share it with you in this way. You just ask the question, get the information, and then you insert the needle straight away. It's much easier for you to follow. That's why I show it here. But also I need to mention that we have other strategies as well. Now, next, come to Chinese medicines. It can start with any of the sign, no problem at all. So, so the next thing that I'm gonna share with you is Chinese medicines. Hot flushes. Chinese medicine work very well for hot flushes. And in fact, in Huangdi Neijing, they say, now most of you do acupuncture, right? And Huangdi Neijing said, when it's weak, yin, yang, qi, and blood are all weak. Don't use acupuncture. Apply herbs instead acupuncture. You see what I mean here? That when there is not enough resources in your body, we don't do acupuncture. That is why, and people very hungry and they're very tired because at times they haven't got enough energy and resources, and they give them needles and they pass out. They faint, they get dizziness, they get unwell, they want to vomit. Why is that? Because they haven't got enough resources in their body. When we do acupuncture, what does acupuncture do? Well, most of us understand that when we insert needle in, we are regulating the qi and the blood, right? We are improving the sorry, I forgot to. We are improving the blood flow, increase the blood flow, as well as increasing the energy run through your meridian pathway, right? So when it comes to acupuncture, you treat the body. It actually based on using some of your energy to push the energy and blood. If your body hasn't got enough energy, very basic energy, you're too tired, and it's not going to work well. It is not going to work well just with acupuncture. Why is that? Because you haven't got enough energy for a needle to work. Does that make sense? Well, you need to move that much of blood, but you need to use some of the blood. Acupuncture in, and you need to use up that much of blood or energy to push this much of blood and energy. I hope this makes sense to you. So therefore, it comes to herbs. It's important. So therefore, when you get acupuncture to a patient, they still need to eat their food when they go home. They can't say, "Oh, I'm feeling great. I have better energy after acupuncture. So go home. I don't have to eat anything." No, because they still need resources. Right. All right. Hot flush, heat. When it's indeficiency, we use 六味地黄丸 or 知柏地黄丸. If the patient come with the vision's not very good, very dry eyes, then you can add on 枸杞子 or 菊花. It also called 齐聚地黄丸. Right. Well, if this yang deficiency that it could not store the yang energy, and the yang energy came out, it mostly come with cold hands and feet, what do? 金匮肾气丸. This nourishing the yang energy. Now I want to share with you, when it's cold hands and feet, it may cause from spleen deficiency. Spleen qi deficiency, you need to use 四君子汤, 六君子汤, because spleen deficiency, it can cause cold hand and cold feet as well. So hot flush, most of the case that in the clinic, the patient come to see you, most of the time is the yin deficiency, which is 齐聚地黄丸 or 知柏地黄丸 or 六味地黄丸 will work very well. But there are some cases they are caused by yang deficiency or spleen qi deficiency. So you need to change your formula. All right. That's it for today, and I hope all this helped. We mentioned a bit of Chinese medicine. I hope that helped too. Now, tomorrow we're gonna talk about acupressure point for hot flush, right? And the next day we're gonna talk about the day after tomorrow. We're gonna talk about the diet change, lifestyle change for hot flush. Well, I hope this helped, and I'll see you tomorrow morning. And stay awesome, and please give me a thumbs up and leave your comment down there. What, if you're a practitioner, what strategy do you use that's been working very well? And I hope you can share with us and we can learn from you as well. All right. Thank you very much, and stay awesome. Bye. Happy Day say I tried by Hui 12 scalp for patients with diabetes, and it reduced the frequent urination. Good on you. It may work even better by Hui 12 plus moxie brushing on top of your by Hui 12 while they have by Hui 12. You may find that it work even better for frequency urine. Right. Stay awesome. Thank you very much for sharing. Okay. See ya.